This is your introduction to wellness programming with Ridgeway and Associates. And I want to try to cover a few things like therapy and check-ins. And then I want to make sure to answer kind of ahead of time any things you might be wondering about confidentiality, our locations, how to get in touch with us, things like that. So let's get started. So I'm Marie Ridgeway. I am the owner of Ridgeway and Associates, and I've been doing private practice since 2017 and working with first responders. All of us are master's level clinicians. I received my master's degree in Omaha, Nebraska, and my undergraduate out at Gonzaga University in Washington. I'm from Minnesota. I grew up in Duluth and moved back here after my master's program. So I've been in the area now for quite a while, and I worked at Hennepin County, and I was in child protection and on the psychiatric crisis team before opening my practice. So I've been training law enforcement for many years now and continue to do so. But every year we are providing multiple different services to a few thousand first responders in Minnesota. And then more recently, I'm also partnered with a national company to provide training as well. So involved in our wellness programming, we provide therapy, including ART, otherwise known as accelerated resolution therapy. Super important for you to have access to that. We do many hundreds of ART sessions for first responders every year. This addresses stress and trauma and other sort of stress and performance related issues that you might have. We provide mandatory check-ins for the vast majority of our agencies. And then for select agencies, we provide on-site services. We might be doing debriefs, ride-alongs, attending meetings. That just depends on the type of contract that your agency has with us. We also have a new service called neurofeedback. You'll learn more about that. Select agencies have opted in to provide that service, that treatment type. It's a great add-on to ART. Anybody having symptoms like anxiety or depression or sleep disturbances, or maybe need to kind of clean up some symptoms after using ART. It's a great option there. We provide healthy family meetings. So this would be where maybe your new hires meet with us and we pair up with like a peer support team member, maybe a training officer, and really try to give you the information you need at the start of the career so that you and your family can know what you're getting into and know how to navigate it well. We, of course, provide lots of critical incident support, and then we are partnered with an app-based service, which you'll hear more about, and maybe your agency will opt into that as well. As far as training, lots of post-trainings. The biggest, most ongoing training I've done is our 30-hour peer support training, but lots of different topics I train in regarding first responder wellness. And then I do train other therapists in how to work with law enforcement. I'm a clinical consultant for multiple CNT teams in Minnesota, and then also provide facilitation for multiple peer support teams as well. Overall, what we're trying to do at our practice, we specialize specifically in first responders, and the majority of the first responders we work with are law enforcement, but we work with fire departments as well, and corrections, dispatch, everybody's included. We want to increase quality of life. We know you have a super stressful career and it can take a toll on your quality of life. We want to help mitigate the common stress response. You have such high exposures to stress, the accumulation of stress can really start to take a toll, so we want to help you address that. We're super passionate about suicide prevention. We want everyone to know there's always something that can be done. You're never alone and you're never trapped without a way out of the way you're feeling. And so we assist with that. And then ultimately, we want all of you to have somebody who knows how to help if you ever need it. So if you're doing well and you come in and do a check-in, if nothing else, hopefully what you gain is, hey, this is somebody who I'm familiar with now, and I'll give them a call if I need something. We hope you're doing great. If at any point you're not, though, we want you to be able to be familiar with us already and reach out. So here's the team. Carly and Nicole are also full-time, and then Jerry and Natalie have evening and weekend hours. And we work out of 2 offices in Shoreview and in Bloomington. Shoreview is our larger office. We have 3 offices there, and then Bloomington is just one. We also have Becky on staff. She provides neurofeedback, and she joined us in 2024. You will also meet Charlie and Callie, our therapy dogs. Charlie is our original. He is about to be 5 years old. Both are purebred German Shepherds. Callie came to us at 3 years old. She was previously someone's service dog with some pretty expensive medical needs, so I snagged her and she's been wonderful. She was already so well trained. She's a little honey. She's a Velcro dog with me, and Charlie will often spend days with Carly and can go along with other staff to attend different things. So we provide specialized care. We only provide mental health care to first responders. We work exclusively with first responders now, and I would say it's about half and half. When someone is coming to us for support, it's either a professional stressor or strain they're experiencing, or personal. Tends to be about half and half. And we provide employer paid sessions. Of course, we have contracts with cities and counties, and the employer is paying for 6 to 12, sometimes even 18 sessions, and some agencies provide unlimited sessions. All of our work is, of course, confidential. You have protections through the law. You have privilege with us, just like you would with a legal spouse or an attorney. In the way we practice, we don't diagnose, so we are not creating a formal label or diagnosis for you. A lot of the times, by the time we help somebody, they wouldn't qualify for that diagnosis anymore anyway, so we can just avoid that potential barrier. And really what it comes down to in our work is stress. So first responders are very mentally strong to begin with, and stress can take a toll and have ripple effects into personal life and relationships and sleep and all kinds of things. So that's really essentially what we're helping you with, is the stress symptoms. Very, very rarely are we helping with severe and persistent mental illness. It's usually stress and trauma and those ripple effects. All right, so you're going to be doing check-ins with us. Like I said, the vast majority of the agencies we work with do have mandatory check-ins. So we do over a couple of thousand of these every year. We break them up into quarters. So your check-ins will occur in quarter 1, 2, or 3. And it'll be you and another batch of agencies that are fit into that quarter. So what is a check-in? First, I'll tell you what it's not. It isn't therapy, it's not treatment, and it's not any kind of evaluation. We have nothing to do with evaluating you. This is written into our contracts. Sometimes folks forget, but we cannot return you to work. We cannot evaluate your fitness for duty. We have no interest in any of that work. We only care about taking care of you. So sometimes those lines can tend to get blurred, but not at our practice. We're very firm about that. Nothing from a check-in gets documented in a medical record. If you're going to continue on and opt in and do some therapy with us after your check-in or before, maybe it's helpful to take some brief notes, which we do for therapy sessions, but not for check-ins, not typically. So we just verify that you attended. Since everyone is required to attend, we do put on the invoice at the end of the month your name that you attended, along with the batch of others who came in for their check-in as well. And then we are not diagnosing in a check-in, or ever. We're not diagnosing. So what is a check-in then if it's not all of those things? It's really just a consultation with us. It's a benefit your employer is providing to you. We provide some education, and we are happy to talk about what you would like to discuss. So if things are going well, we'd love to talk about what's going well and what you're doing to stay resilient, and different areas of your life that you're enjoying. That's great. We don't normally have people reach out because things are going well. They reach out when things are not going well. So it's fun to chat with you as well. We have no expectation of what you share with us. And if nothing else, you can get familiar with us and our practice and what to expect. But some people certainly come in and are like, here's what's going on, let's talk through this. And we get started doing that, and that's fine too. So we're really laid back about it. Sometimes it's a little more nerve-wracking the first time an agency is doing all staff mandatory check-ins, but after that first time, we always see folks ease up and kind of be like, not a big deal. We're not worried about this. And then glad they have a resource to call on if you ever need it. This is what you'll do to schedule. You'll receive a link and you'll schedule online. So you'll choose the office you want to go to, the clinician you want to meet with. You'll provide some information for us, and that'll get you scheduled in our system. It's pretty easy to do. So some of what we'll talk about with you in your check-in, I'll just kind of introduce here. Your brain and your nervous system operates as a bank account. We know that built into your job is a whole lot of withdrawals. So you really need to be making deposits to kind of keep that bank account nice and full. You want lots of money in the bank account, of course. Any bank account you have, you want it to have lots of money in it. You start to feel the effects if you don't, right? When withdrawals are taken and you start to run low on funds in any account, it starts to get kind of painful. So we help you keep an eye on that. And we also help you keep an eye on how stress can accumulate. So over time, imagine this container starts to fill up. Really, your body is the container for emotion. We hold stress in our bodies as tension, and it can start to stack up. It isn't usually just one thing that really starts to make a difference. It's the accumulation of lots of trauma exposures over the years. So we're gonna try to help you stay on track with your resilience by thinking of these 6 areas. We're looking for deposits that you're making. Are you getting good sleep? That's going to be your most important one. Non-sleep deep rest is another great way to kind of press the restart button on your brain. We'll talk to you about exercise, nutrition, hydration, support. Do you feel supported at work? Do you have a solid support system outside of work? If you have a partnership outside of work, a relationship, a significant other, is there strain there, or are things there going well? We do couples therapy. A lot of the therapy we do is couples therapy. We're specifically trained as couples therapists in addition to trauma therapists, so we can offer that to you as well. And then we're certainly wanting to hear about if you have a balanced life. Do you get to do anything for fun? Do you have hobbies? What keeps you balanced outside of work? Your mindset. That's something you can usually listen for as we're chatting, is like, what is your attitude towards this difficult job? And some people come in saying, look, what's struggling is my attitude. I need to figure out how to manage this better, how to look at things differently, really kind of reprioritize, not feel trapped, things like that. So we certainly have lots of those conversations. And then professional care. So are you getting in for your annual physical, dental cleanings, all these good things? Are you willing to reach out and ask for help sooner rather than later? You have stigma towards mental health care, maybe in a different way that you wouldn't if it were physical care. So that's another factor that we're trying to address when your agency has you do these check-ins. They're trying to encourage you to be willing to reach out and get the help you need. It is so common to need some support along the way in your profession, and that's what we're here for. So all of your work with us, your meetings with us, your appointments, check-in, therapy sessions, all of it is confidential. Nothing gets reported back to your employer about the content of any of that. And if you're seeing us for therapy, that's because you've opted in. You can see us before before it's your quarter for check-ins. You can see us at your check-in and say, hey, I want to do some more sessions. You can see us after during the year, whatever you'd like to do. And those therapy sessions will be billed with just a code. So it's an anonymous code that only we know it applies to you, but your employer will never know that you saw us any more than just that check-in. So we don't have any other information shared except for your name along with those check-ins when they're mandatory. And the only time we would have to break confidentiality is if you were an immediate harm to yourself or another person and there was nothing else we could do to keep you or someone else safe. So that would be an extreme outlier situation. We do have folks very open with us about having thoughts of suicide, and that does not necessarily mean immediate harm. So we are very fluent in suicidality. Sadly, it's very common for first responders to have those thoughts. And so we know how to not overreact and not underreact. And so that's an important piece of the kind of specialized work that we do. So that's kind of the gist of it. Here's how to reach us. You can certainly check out more information on our website, marieridgeway.com. If you go to the resources tab, you can see a lot more about accelerated resolution therapy. There's a program participant tab with lots more information on the resilience factors. You can schedule therapy with us by emailing information at marieridgeway.com. And then when it's your time to do scheduling for your check-in, you're going to use our app. That'll be emailed to you. And then our phone number is 612-314-9169. And that's how you can call us. So you're welcome to do any one of those things. One of us is always on call 24/7, actually usually two of us. So if you do have an urgent need after hours, please don't hesitate to reach out. We'd love to be able to help you. These are our locations. We're in Shoreview on County Road E, right off of Lexington. And then our Bloomington office is France Avenue South and 494. So thank you so much for your attention and your time and for trying something new. If this is a new agency for you, or if your agency is new to our practice, we are super happy to be working with you and excited to meet you.